Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan, and my mission is to make psychology accessible to all. In today's video, we are going to talk about antisocial personality disorder. You may have heard the term sociopath, or you may have heard the term psychopath, but in the DSM-5, these are collapsed into the condition that we call antisocial personality disorder. So, without further ado, let's talk about the condition. So, what is antisocial personality disorder? Well, it really comes down to people who persistently disregard the basic rights and welfare of other people or animals. So, they're more likely to torture animals, they're more likely to engage in criminal behavior, violence, things like that. So the DSM-5 with personality disorders in general, but with antisocial personality disorder, requires 18 years or older to reach this diagnosis. So we're not going to diagnose children and early adolescents. That being said, many people who do get the diagnosis of antisocial personality disorder are already showing antisocial behavior prior to the age of 15. And the most common condition that we talk about is something called conduct disorder. And conduct disorder comes with truancy, bullying, torturing animal, arson, things like that. And that's already present in childhood. So just because we're not going to diagnose until 18 doesn't mean that the warning signs are not there. Individuals with antisocial personality disorder are not, it's not uncommon for them to lie repeatedly, be reckless, or even impulsive. And in terms of their behavior, it's usually linked to some criminal behavior, and these individuals can be described as either cruel, sadistic, aggressive, or violent. Now, that's the general introduction, but let's talk about the DSM-5 criteria. If we're going to diagnose a person with antisocial personality disorder, they have to show a pervasive pattern, an ongoing pattern of violation of the rights of others that has been occurring since at least 15, if not earlier, and other warning signs have been shown even prior to the age of 15. So they need 3 or more of the following. First is that they fail to conform to social norms with respect to laws. So they're going to engage in behavior that could result in them being arrested. That doesn't mean they actually have to be arrested. Even doing the behavior that could lead to an arrest is one of the symptoms of antisocial personality disorder. We also see deceitfulness, lying, and conning other people for their own personal benefit or pleasure, things like to obtain money, sex, power, whatever it might be. Individuals are going to engage in this process. There's impulsivity or failure to plan ahead. There's irritability and aggression, so there's a greater risk of physical violence and assault. There's reckless disregard for the safety or of themselves and other people. So drug-related behavior, risky sex behavior, risky driving, speeding down the highway, etc. These are all disregard for safety. We see a lack of responsibility and accountability. Individuals with antisocial personality disorder struggle to maintain a job and honor their work obligations. And there is a lack of remorse, as indicated by them being either apathetic, indifferent, or rationalizing how they've either stolen or harmed another person. They might say, well, that person had it coming to them. Now, these 7 criteria, you don't need them all, as I said. You only need 3 out of these 7. The more severe it's going to be. Now, in order for you to get this diagnosis, as we said on a previous slide, you have to be 18 years or older. And this cannot be as a function of schizophrenia or bipolar disorder in either a psychotic state or a manic state that you engage in this behavior. It has to be exclusively due to personality. So what is the prevalence of antisocial personality disorder? It ranges, it varies anywhere between 0.2% to 3.3%, but we see that there is a significant rate or a higher rate amongst males. We see there is a significantly higher rate amongst people who have alcohol use disorders. And in terms of treatment locations, we see really high rates in places like substance abuse clinics, prisons, or forensic settings, which should not shock you because things like prisons and forensic settings are, based on legal regulations. So if a person is violating the law, they might wind up in one of these settings. Now, we also see something interesting, that the prevalence is higher when you have either adverse socioeconomic or sociocultural factors such as poverty or immigration. So you might see some higher rates of criminality or antisocial behavior, but there is a debate whether we are over pathologizing or over diagnosing people who are engaging in a protective survival strategy rather than because they're inherently, it's part of their personality. So that is a concern that remains out there, and I figured I'd put it into this video so you could think about it. But now let's talk about how theorists explain the disorder and some recommended treatments. So the 4 different lenses are the psychodynamic, behavioral, cognitive, and biological lenses. These are the lenses we're going to look through. According to object relations theorists, it's due to an absence of parental love. And if parents don't give their children love, there is a lack of basic trust and attachment, and that leads to later mistrust, suspiciousness, and criminal behavior. From a behavioral point of view, we suggest that it was learned through modeling or some kind of unintentional reinforcement. Modeling means we saw someone else do this and we're copying their behavior. Unintentional reinforcement doesn't have to be us seeing other people. We might have gotten praise for doing a criminal act. So that would be unintentional reinforcement. From a cognitive point of view, there is a mindset that trivializes the importance of other people's needs. So we disregard or trivialize, minimize other people's needs, and that's a cognitive error. And from a biological point of view, we talk about neurotransmitters, brain structures, and thrill-seeking attributes. So as it relates to neurotransmitters, lower levels of serotonin are implicated in antisocial personality disorder, and they do increase the risk of impulsivity and aggression. We also see in brain structure deficient functioning in the frontal lobe of the brain or the prefrontal cortex. That's responsible for making good decisions, judgment, decision-making, planning. Well, if there's deficient functioning in the frontal lobe, you're going to be more likely to engage in, criminal behavior because you don't have the filter to say maybe no. And then in terms of arousal, people who have lower baseline anxiety and arousal might be more likely to seek thrills or take risks to feel a certain level of arousal. So These are the three common biological explanations. So now let's talk about treatment. Treatment is largely ineffective because most people with antisocial personality disorder are going to feel as though they don't need to change. They lack a desire to change. And one of the issues with antisocial personality disorder is the lack of a conscience. If you can't feel remorse and you don't have a desire to change, you're not going to go into therapy voluntarily. So how do we get people to go into therapy? Usually it's through the criminal justice system. So they wind up in a prison, or they wind up getting some kind of requirement of psychotherapy to help. And they will then come as mandated by the court, but that doesn't mean that they want to be there. And that's going to reduce the effectiveness of the treatment. We also try and work with how people think about moral issues. This is more of a cognitive approach to conceptualize morality and try and perspective take, being able to put ourselves in another person's shoes and think about their needs. In terms of hospitals and prisons, they've tried therapeutic communities who are trying to, share knowledge and experience to perspective take. And then there has been some trial work with antipsychotic drugs. Antisocial personality disorder, the person is not psychotic. They don't have a break from reality, but when it comes to things like impulsivity and poor judgment, that they are common features with a psychotic disorder and antisocial personality. So we have tried some antipsychotic medication, but there's not enough evidence to suggest that it's worked. So that is antisocial personality. At the end of this video, you should have learned what is antisocial personality disorder, right? This is a person who disregards or violates the basic rights of others. You should know that in the DSM, it is a consolidation of what people colloquially refer to as a sociopath or a psychopath. It is not a person who is shy or reserved, as you say, oh, I'm a little antisocial. No, it means antisocial norm. They violate the basic rights and rules of society. You should know the criterion that need to be met in order to get the diagnosis of antisocial personality disorder. You should have acquired the basic theoretical conceptualization from a biological, behavioral, cognitive, and psychodynamic point of view, and a discussion about treatment and reasons why treatment is far less effective and some of the stuff we still try. So if you found this video useful, if you learned something new, hit the like button, subscribe, click the notifications tab. Each of these actions will indicate to YouTube that this video has some value according to their algorithms. However, for me, I would love if you could drop a comment. Put a comment below and tell me what you thought of the video. If you have a probing question or a reaction, I read and respond to all of them. So I look forward to hearing from you. And until next time, take care, everybody.